Hello and welcome to the eViP website. Today we're here with Emily Conradi from the e-learning unit at St George's University in London, where the medical students have been repurposing eViP virtual patients and integrating them into the medical curriculum as part of the ongoing G4 project. G4 aims to replace paper-based linear virtual patients currently used in problem-based learning with more interactive virtual patients. So students at St George's have been involved in repurposing virtual patients from eViP, and these have been subsequently incorporated into the G4 project. Can you tell us a little bit about this?
So the G4 project is about embedding virtual patients into the curricula for the medical students here, and we're replacing the problem-based learning scenario of the week, which traditionally is a paper-based scenario, with a virtual patient scenario. And as well as that, what we're doing is complementing that with 2 formative assessment virtual patients every week as well. And that's where the eViP repurposing work comes in. So we're finding relevant virtual patients from our partner institutions, and we're getting medical students to repurpose them for the formative assessment for the T year, for the transition year of medicine.
And how would the students go about repurposing? What does the process involve?
Okay, so what we do here is we identify what virtual patients from our partners we think match that learning week. Then we'll send the content to the medical students. So once they receive the content, they put it into View, the visual understanding environment software, and they'll split up the content into neat chunks about sort of a web page size. We send them some virtual patients so they understand really where we're trying to go with it. The content needs a little bit of work in terms of making it more suitable for the medical curricula here. Sometimes it's just about cultural changes, and sometimes the drug names and things like that need to be changed. So they're able to make those kind of minor changes. And then what they'll do is they'll make the format more suitable for our style of virtual patient here. So they'll add decision-making points and branching decision-making. A lot of the virtual patient systems where we've taken the content from use things like MCQs and short answer questions, which we don't use in our virtual patient style. So that's quite a lot of the work for the students there, is making it adapt for the branching decision making. And once they've done that, they'll make 2 versions. They'll make a linear version and then they'll make a branching decision making version. Then we'll get a subject matter expert to check it through, make any changes that they feel are appropriate, and send it back to the student for a final revision before we put it online into Open Labyrinth.
So it's a really good example of how eViP virtual patients can be incorporated into an institution. It's absolutely fascinating. What's the value for the students who are doing the repurposing? I mean, we presume it's going to be a beneficial process for them.
Absolutely. We've got really positive feedback from the students involved. What they're finding is that they're learning a lot about that subject matter just from reviewing the case in quite a lot of detail. Often they feel that they will have to do some research around that area, just so they're sure of what they're putting and any changes that they make. And yeah, they definitely have reported to us that it's really beneficial, and they've learned a lot just from creating a virtual patient in that way.
And can you see more student-led projects involving the creation and peer review of virtual patients taking place in the future?
Definitely. I think it's definitely an area we'll keep running with. We have a thing here called a special study module, and we've put out for volunteers to make e-learning resources such as virtual patients for them, and we always get a lot of applicants quite enthusiastic to be making those kinds of resources. And it's great because not only do we get great resources from it, but we also really help the students with their learning, and they really feel that they have enhanced their knowledge through that process.
It's really interesting, and it's good to see how eViP virtual patients are being used by students as well in the curriculum. So thanks so much for talking to us.
It's my pleasure, thank you.
For further information about the eViP programme, please explore the eViP website. And for news and updates, you can follow us on Twitter on www.twitter.com/virtualpatients, or you can even join our Facebook group at www.facebook.com/virtualpatients.